Right here on the number one breakfast show in the country, Morning at NTV. My name is Romeo Busiku. Well, we are here with yet another pertinent conversation, addressing gaps within the public health services. I do have Daphne Namukuza Olga. She is the program's manager, COVID-19 response program at the Aga Khan Foundation. There's a project that has been expedited for the next 2.5 years, and it's going to be geared towards acquainting, yes, the CSOs with the necessary information that they need, the tools and the resources to help fix the gaps within the public health systems within here in Uganda. Olga is here and she's ready to acquaint us. A very good morning, Olga.
Thank you. Good morning.
All right. Talk to the viewer about this very, very enlightening project.
Thank you so much. Good morning to our viewers as well. As I mentioned, the Aga Khan Foundation is an agency of the broader Aga Khan Development Network.
Indeed.
We are launching a project that is responding to the adverse effects of the COVID-19 within the country, because we know, of course, COVID-19 is not something that we need to go into around how it has affected the different groups of people, but we also know that we have been affected differently depending on our vulnerability. So the people living with disabilities have been affected differently, people living with HIV have been affected differently, young people and women, even the men have been affected differently. So we are launching this project to work with partners, CSOs. We want to provide funds to CSOs to be able to design sustainable interventions within the face of COVID, and to also be able to address the challenges that their communities are facing. And then we also want to flip it over to the entrepreneurship bit of it, because we know that it is not enough to just tell people that please be safe. People need money. If they don't have money, they will not stay at home. So we also want to have a big aspect of entrepreneurship and skills building for young people. And then we shall also support innovations in terms of small and big business, okay, not very big businesses, but micro businesses and macro businesses that have had a setback. We have some funds set aside for some innovations for them.
Well, the viewer is wondering, why is it so crucial for us to strengthen our health systems, especially during this COVID-19 pandemic? Could we elaborately compound on that?
Yes, we can. So what the COVID-19, the truth is, as a country, we were already having a weak health system. But what COVID did is that it came and it made it even worse. So it put a light on something that was initially ignored. It put a lot of pressure on the government in terms of how do you actually support health systems, because now in a country that has so many problems and so many diseases, now we are coming in with COVID, a lot of the other health issues have been ignored. Issues of teenage pregnancy have really gone up. Issues of health have really also been ignored. So we realize that the government is overwhelmed on the one bit, but also maybe a shortage of resources here and there. So that's why we are coming in as development partners to try and close that gap and supplement the work of the government in handling the resurgence of COVID-19.
Let's talk about the crucial importance of actually helping or supporting women and youth to actually cushion themselves against the adverse effects of this COVID-19 pandemic. Let's talk about that significance.
So we realize that, like I said, we have all been affected by the COVID-19, but we realize that some people more than others. I mean, if I'm to borrow from Animal Farm, they say we are all equal, but some people are more equal than others. So we have all suffered, but some people have suffered more than others. And we find that the women and the youth have been most affected. The young people, the schools are closed, first of all, so it means that they have to stay at home, or they have to find alternative ways of education. Then you also find that even at home in the environment, it is also not very conducive for them, because parents are expecting them to be able to provide something on the table. Then women, because they are mainly in the informal sector, and we know that it was mainly the informal sector that was closed down, the hawkers, market vendors. If you look at the people who work in hotels, you know, if you look at the people who work in the malls, majority are the women. So we realized that much as COVID affected all of us, the youth and the women were particularly hit in a harder way.
And of course, you're calling for a need for a multi-sector approach, not only the Aga Khan Foundation, but other stakeholders, so that you can be able to alleviate this challenge. What is the significance of having a multi-sector approach that is not isolated? So
the importance of having a multi-sector approach is that you can't be everywhere. The project that we are implementing is going to be in the districts of Kampala and Arua, but those are not the only districts that are having challenges. So in our work, we have actually had pre-activities with the Ministry of Health, Ministry of Gender, with KCCA, with the district local government in Arua, with the COVID-19 task force. And the aim of this is to create ownership of the program and to ensure that our interventions will actually be sustainable after the project life, because you may find that Olga may not be there to run the program, but if the Ministry of Health is involved in the intervention, it gives it a bigger chance of sustainability, or even being incorporated into the ministry intervention as part of it. So we believe a multi-sector approach is good for ownership, but also for issues of accountability and bringing together that specialization contribution. Someone brings health, someone brings education, another person brings the social sector, and Aga Khan then brings in the fund. So you realize that you work much easier together if everyone is handling one pillar of something rather than Aga Khan taking on everything.
What you're expediting right now is more of what the Democratic Governance Facility was doing for our NGOs. You are now funding our CSOs so that they could handle this multi-sectoral approach, education, social services, and also health in that multi-sectoral targeting. So the need for innovativeness and creativity has also taken center stage, and it's also a conversation you would like to have with us.
Yes,
acquaint us more with that.
Yeah, so we realize also that COVID dictated a new normal for us.
Indeed.
And we realize that we cannot continue doing business as usual. There are a lot of modalities that have to then be taken into consideration. There are some businesses that have failed completely because of COVID. If you look at businesses of schools, you would have never thought that 5 years ago schools will be out of business, but they have failed. And yet there are businesses that have boomed because of COVID. Online services, delivery services, they have increased. So for us, what we want to do is that we want to support these business owners that are able to think outside of the box and address the challenges of their community amidst the pandemic. So we want to come up, we want to support innovations. We were looking at early childhood development because if you see, much of, we have guidelines for young people in school, primary, secondary school, but people in nursery school, no one is talking about them.
They've been under lock and key since 2020.
They have not gone to school, and you're going to find we're going to have 8-year-olds in baby class. So we want to challenge partners out there who can design interventions for early childhood development. How can you support these children to access education? How can you support agribusinesses? Our biggest export as a country is coffee. How can we support more business owners, more young people to come up looking at coffee, looking at, cash crop growing in Uganda, looking at it not as a rich man's kind of thing, but looking at how can I start, even if it's with a garden behind my house. So we really want to prompt that creativity and innovativeness amidst that.
When it comes to early childhood learning, it couldn't have come at the right time. You have students within Oyam district, primary 5. A young learner can't actually count from 1 to 10. That is how callous the situation is. I was reading the Daily Monitor, and they were also talking about the need to reopen schools as soon as yesterday so that our children could go back to the school setting. We also do know there are so many benefits that come with early childhood learning.
Exactly.
You do have cognitive abilities of our children actually rising exponentially and so forth. Let's talk about other significant factors that will arise from these early childhood education initiatives.
Yeah, so what we are looking at is, of course, from the business side of it, we're looking at supporting business owners, because if you look at many of the partners in the early childhood development, they are private businesses. It will be hard to find a government-funded nursery school.
It's never there.
It's not there. UPE hasn't yet thought about how to cater for us in the nursery schools. So you find that many of the sectors, many of the people in the early childhood development are private business owners, and what they were told by the government was go and sell the business and do something else. But given the passion that they have, you may find that it is a bit difficult. Then the other angle is, of course, looking at the child. We all know what importance it is for you to have that firm foundation of your nursery school. For some of us who went to St. Jude, we are here struggling, more than kids who went to Aga Khan. If you find a child who went to Aga Khan, by the time they're in P1, they can express themselves, they can
write a letter.
They can write a letter. They can even be bold and tell you, I don't like this. But you find that since now, and then the challenge
they
is
know
that
better.
They know better now. The challenge is that many parents do not exactly know how to handle their children, because even with some schools introducing Zoom classes, you find that a child is in the Zoom class by themselves, their parent doesn't know what they are studying, then the child sometimes wanders off on the internet. I've had challenges with my little brother, and he's 9, where you put him on a Zoom class and you find he has slept. And he has slept, genuinely he has slept. I think maybe it's not as interactive. So imagine if a 9-year-old can't keep up, then what happens to a 3-year-old? Now what is happening is that now many parents are taking their children to home-based teachers, and the home-based teachers are really expensive, and I don't know how the Ministry of Education is going to do it, reintegrating teachers back into a school setting. Because if I give you an example, my other little brother is in nursery, and even him, we started enrolling him in a kind of village school at home, where he goes to the teacher and they study. The teacher is charging 50,000 every week, and at the end of the month we have to pay a total of 200,000 for a 4-year-old.
Meaning poor families might be unable to actually foot those bills.
But also if you look at what the teacher is doing, if they're covering 5 students, they're making 1 million in 1 month, no NSSF, no transport costs, no nothing. So the question will be is how will you then convince them to come back and work for you at the salary rates of government when they can clearly make this money out of school. And even for their parents, people are now realizing the advantages of homeschooling. Homeschooling was a myth in Uganda, but now many people will be like, why should I take my child to pay you 5 million when I can engage this lady? She gives my child all of this. So I think,
of course, the reality is different within the rural settings, and that's where Aga Khan Foundation comes in to see how do we extend these technological services to our learners within the rural settings, so that they also catch up with their counterparts within the urban settings. Talk to me about that.
So even with a rural setting, we're not exactly looking at technologies, but we are looking at something that can apply in a rural setting. We want to revive things like tree learning. You know, if we're able to engage a teacher in Kampala to be able to collect students, are we also able to get a nursery teacher in Arua and be able to facilitate them or support them to be able to share some of their best practices? The other thing that we are doing in another project with Aga Khan is that we are also collecting evidence around learnings of schools. We realize that if you look at the teaching model, when you're in nursery school, you have a deeper connection with your teacher, but the higher you go, the less attached to the teacher it becomes. So we want to pilot a model in terms of, if we are able to take a nursery school model to senior 6 or to the university, what would be the effects? How would education come out? What would be the quality of education? So we really want to also be able to meet the rural young people where they are, not trying to subject them to Zoom, because you will take your Zoom, but the network in Arua is beyond them. Exactly. So trying to have something that is applicable to them and works for them.
Let's see how the Aga Khan Foundation will be addressing gaps within the health system. We do know that urban dwellers could have close proximity to these health facilities, but then the rural dwellers are actually far away from these health centers, and in other cases they are non-existent. That's why the Aga Khan Foundation is going to be coming in to address that gap. How? So
what we want to do is that first of all, the Aga Khan, like I mentioned, the Aga Khan Development Network, there's other partners like the Aga Khan Hospital. So what we want to do is, of course, health systems strengthening starts around capacity building. So we want to support the regional hospitals in Arua and also other health facilities in Arua in terms of how do you improve data collection, in terms of how do you improve engagement, in terms of how do you improve youth-friendly service provision for you to be able to get, you know, more clients to come on board. And then, of course, we are going to be proactive in terms of producing masks, in terms of producing sanitizers, and also being able to be proactive in a
through the CSOs.
Through the CSOs and also through the hospitals themselves. Because if we go to, like in Arua, if you go to the regional hospital, you engage with the hospital and they tell you these are the communication materials we need. Maybe we need some wash facilities, maybe we need some people trained, maybe we need you to be able to send us some vaccines or to send some testing kits, something like that. So we really want to supplement the work of the government. We don't want to replace them and say we want to come over and take over what you're doing, but we want to support to fill in those gaps.
So you're supporting the existing structures, the existing civil society organizations that were already there working tooth and nail to ensure that they front these services to our people who cannot access them with the money and the tools. Nice. On the issue of unemployment, you're also going to be bankrolling some CSOs to help young people cushion themselves from the impact of this COVID-19 pandemic, young women and girls. The issue to do with the agribusiness, compound more on that. How will they be receiving help, courtesy of the Aga Khan Foundation?
So what we are doing is that currently we are identifying the networks in which the different businesses exist. I've come to understand that in Uganda there's an association for everything.
Indeed, there is.
The Boxers Association, there's an association for everything.
Indeed.
So even if you're looking for issues of agribusiness, there are different associations and networks within which these businesses have come together. So we are reaching out to those associations and those different networks, and we are going to put out a call for innovations. We shall set up a panel of judges, and then we shall put out a call that will be open to anyone and everyone, so long as you can put in your proposal. It will not be anything extreme like you're putting in a bid, because we understand that some of these businesses are really small and they don't exactly have all of those things. So we are going to put out a call. It's going to be a healthy competition. We shall have judges, and we'll be able to give out funds from as low as maybe 5 million to even as much as 20 million or 25 million, depending on what your need is. But it's going to be very healthy, and it's going to be a competition that is.
And of course, you said this is a multi-sector approach.
Yes.
But then, what kind of help might you need from the government to aid you when it comes to advancing these resources to the various CSOs within our country?
Yeah. So of course, what we needed from the government is authentication of the existence of these CSOs, because in Uganda, 1 minute you're legal, the other minute you're on a list. list that you've been closed out.
Indeed.
So the first
the
thing
shrinking civic space.
Exactly. The first thing that we need from the government is authentication in our choices to say these are the CSOs that we have chosen and these are CSOs that you're also comfortable working with. And then the next thing is we are also looking at ownership of the program. Like I said, the interventions that we are putting forward, we are hoping that they can be sustainable amidst the pandemic. COVID is not about to go away soon.
Indeed.
People are talking about a third wave. So we want to ensure that we are equipping the government with some best practices that they can take on even beyond the
And of course, like you said, COVID-19 is not going away. 120,075 cases have been registered, 3,023 people have died. So in that respect, COVID-19 aside, because it's already the challenge of the world right now, what other challenges do you anticipate to find along the way as you expedite this 2.5-year project?
So the biggest challenge that we see is the issue of economic dependency. Most of the people are not economically dependent. Many people lost their jobs. Independent, yes. So many people lost their jobs. Many people are not able to work. Many young people are out of school. So the biggest challenge that we are seeing now is the issue of money. People don't have money. And it's going to be very difficult for you to tell me anything if you're not able to give me money. So for us, what we want to do is that we also want to work with learning institutions to design an alternative education course for entrepreneurs. Many of the people in Uganda, hustlers, all of us hustlers, we are entrepreneurs without the formal knowledge of entrepreneurship. So for us, what we want to offer you is a course that you can get from a learning institution that is not going to be complicated. We're not going to ask you for your certificates and whether you failed or why not. We just want to be able to support you with some knowledge and some skills. And if your business is really, really that convincing, we can even give you some funds for you to be able to put in and also increase it.
The Aga Khan Foundation honoring its corporate social responsibility right there, reaching out to the communities that they care for the most. Dafin Olga Namukuza, the Programs Manager, COVID-19 Response, thank you very much for joining us. And of course, to all the CSOs and other stakeholders, it is incumbent that we join hands to alleviate the suffering of the many vulnerable people who are being, affected by this COVID-19 pandemic. My name is Romeo Busiku. Let's take a breather. A lot more is within the pipeline. Be right